You should not listen to this with small children around. It may lead to trauma, and I cannot be held responsible for any therapy that may be needed. Listening discretion is advised.
From day one, you fought for your life, and you blew everyone away.
Hello.
Hi, welcome back.
Welcome to the show.
I'm Jesse.
I'm Alisha.
And we are...
Changing the chances.
Yep.
Got to make it a little exciting, upbeat.
Okay.
I don't know. We want people to want to listen, right?
Yes. Yes, we do.
Got to keep them on their toes.
I'm pretty sure that, if they have the same feels that we do, we're on our toes all the time. Piper keeps us right there on our toes.
Yes. Very true. Very true. So
That being said,
dun dun dun.
nothing too crazy.
No. Just more like a life update
Yeah.
ish.
Yeah.
Esque. You know.
We thought we'd just talk about a procedure that Piper just had and maybe touch base on some past procedures and some procedures that we've got coming up.
Well, that's fair, yes. That's kind of the plan. But knowing who we are,
Squirrel.
we probably won't talk about all that. But here we are anyways. So last week we did mention Piper was having a procedure
Yes.
the next day. So we have officially done that.
Yep.
And we do not see it as a win.
So maybe let's just kind of tell them what the procedure was.
Yes. Okay, so let me lay it out for you. Piper has high tone.
Increased muscle tone.
Increased muscle tone, which means she has a hard time moving her body because basically her muscles are always flexing very tight. So for this procedure, the whole point is to go in and make it so her muscles are loosey-goosey, and we
God, I wish you would not say that. I do not like that when you say that.
So what they do is they do a lumbar puncture and they push baclofen into a space in your spine. Baclofen is basically a muscle relaxer. It's probably the best way to describe it in simple terms.
Yeah. Layman's terms, it's a muscle relaxer.
Yes. So then they put it into the space in your spine. So it goes through your whole entire body so they can see what your body looks like when you don't have any tone or high muscle tone or increased muscle tone. What your body would look like if all your limbs could move freely without your muscles inhibiting the movement. Basically it, right?
Yeah,
I've touched.
That's exactly what it was.
And we had very high hopes.
We did.
Very high hopes.
Maybe not like high hopes, but we sure as hell didn't get the results that we wanted.
Walking out of this, I don't feel like we got any. Personally, my opinion, my feelings on it, I don't feel like we got any.
I feel like we walked out with maybe more questions than answers. So yeah.
Oh, definitely. Definitely.
So Piper, I unfortunately wasn't able to go back during the lumbar puncture. Only one parent was allowed back.
This is very true. But Jesse was also very quick to nominate me.
Yes. They're like, so only one parent can go back. I'm like, yeah, there's mom.
So he says he's very sorry, but he was very quick to nominate me, okay?
Let's be honest. We know who Piper really wants in there with her.
Well, you know what? I don't think she cared at this moment. It was a terrible experience. I hated every freaking minute of it. Obviously, Piper hated it more.
So when Alisha and Piper and the nurse come back, the nurse right off the bat was like, that was brutal.
It was terrible.
The only other, there was no other word for it. It was brutal. And Alicia's like, yeah, they had to poke her 3 times.
And honestly, I'm making up the number 3. Because the way she was laying, they have her lay on her side. They did put numbing cream on her back before we went in to help. But once you get in and you start,
I can't imagine how much that really helps.
Yeah, it's only helping surface.
I'm like, it's only skin deep. Exactly.
So they do it under what they consider a live x-ray, so they can make sure that they're getting the needle into the precise spot for this to be effective. For whatever reason, there were complications, issues.
It's Piper. It's always complicated. Nothing's ever simple.
The guy that was performing the lumbar puncture seemed to be struggling or not really feeling like it was in the right area. I don't know. It was a nightmare. And of course, I think Piper would have done fairly well if it had been the one and done. But the longer you're in there, and the more they poke you, the less.
It's just very uncomfortable. I can't even imagine.
I'm in there. I'm just trying to distract her. She starts crying. So then I start crying because we shouldn't even be going through this because it should be already done. But he's like, I'm sorry. Is this the right spot? I don't know. It was terrible. It was awful. They finally do it and they send you back to your room because they have to give it time to work. But it was awful. And
so then the doctors that were doing the observation of this trial, we're going to come in and check on her in 2 hours and in 4 hours.
Mm-hmm.
And by 4 hours, it should be peaked, fully integrated into her system, and they should get pretty much their results.
Mm-hmm.
And they told us, she'll start kind of getting glossy-eyed, tired,
mm-hmm.
And after a couple hours, she should loosen up. And at 4 hours, she should be really loose and...
mm-hmm.
we should have our results. Not the frickin' case.
No.
At all.
No.
Piper did not get glossy-eyed and sleepy. Not even a little bit. And 2 hours in, there was no fucking change.
Yeah, we didn't notice one.
The doctors were coming in and they were checking her range of motion and they're like, oh, well, it's a little bit better and da-da-da. And what they didn't realize is Alicia's kind of already been working with her just by trying to keep her entertained, moving her legs and stretching her out and stuff because, she works with her every day. She knows and, her typical stretches and stuff. And they're just watching it because I can tell. And there was no change. And they were like, well, just a little bit. And 4 hours rolled around and, oh, well, there's just a little bit. And it's like, no, what are you guys seeing? We're not seeing what you're seeing. There's no...
So, what we didn't mention is before they did the injection, they did come in and evaluate her and ask all the questions.
They did. They did
to get a baseline.
They got a baseline.
Yeah.
They did range of motion and pulled out their measurements and stuff like that and everything. And
well, the measurements were still the same by 4 hours.
Oh, yeah. There was no difference whatsoever. And they were like, well, we see this as a positive win. And I was just like, I don't know whatever they're smoking.
My thought is I'm like, first of all, we had to do this. This was non-optional if we wanted to go forward with between procedures, which we will cover. So we had to. This wasn't like we just did this.
This was the gateway. If you want to have other options, this is the stepping stone. You have to do this.
So the professionals can evaluate her, give their opinion, and then you can make a decision as a parent which path to go down. So we're like, all right, well, if we have to do it, we have to do it. And so
I felt bad because it was honestly, we put her through that just to see that
nothing changed.
Is
what it felt like.
And honestly, I didn't really want to put another piece of medical equipment inside of her body.
Okay, we're getting ahead of ourselves.
Yes, we are.
So yes, we left disappointed because we don't feel like we saw any difference. It felt like they were just saying they saw a difference so they could say whatever they say and call it a win. I didn't feel that way at all. And
I don't think they were just throwing in the towel or anything. I just feel like they didn't see anything negative, so they saw it as a win.
I guess, but you didn't see anything is what I'm saying. I don't know how you make a determination for these things if you don't see anything.
I don't know.
To me, they're like, she could go with either procedure. We're fine with that. And I'm like, great, thanks. We put her through all that for you to tell me that.
Yeah.
Wonderful.
I was rather upset with that.
Fan-freaking-tastic. But we were very nice to these people. I understand that
essentially they just have a job that they're doing.
Yes,
and
they
I
just
get
have a
that.
job, and
Piper's
they are
just
nice
another patient.
people. They were nice. They were very nice people.
The nurse was the sweetest. Like but
I'm
great.
just angry about the whole thing.
Disappointed, frustrated, angry. Like poor Piper had to go through that and then deal with a week of like being sore, having headaches, not being able to sit up and throwing up, not sleeping because you get spinal headaches and it makes you nauseous.
So
and your spine is like bruised on the inside and like it just.
So they did tell us like the day after the procedure, you want to probably keep her flat as much as possible to prevent spinal headaches and pain and vomiting. And then she's like, by day 3, I usually get the phone call that kids aren't doing well because they were good the day after, and then they kind of like jumped too quick into like activities.
Yeah, they kind of.
So I kept Piper flat for 3 days. For 3 whole days, all Piper did was lay down. I mean, I moved her from like the floor to the couch, but she laid because. So her procedure was on a Monday and Tuesday night. It's in the middle of the night because this is every time. It's always the middle of the night. If Piper's gonna
struggles in the middle of the night.
Started vomiting, and that was a whole situation.
Yeah, she was struggling.
Moved her out to the living room, and we did the whole sleeping in the living room for a few nights to keep an eye on her and make sure everything was fine. And she's still. We are almost 7 days. Or are we on day 7? How do you?
Well,
it was Monday. It's now Sunday.
Yeah, so it's like 6 days. But
she's still struggling.
Alisha had work yesterday, and I had a friend that invited us to go out to a car show and just to get out and do something.
I was so excited for that.
And so I was thinking, okay, Piper's kind of been cooped up this week, just trying to recover from this bullshit, procedure.
Yep.
And she was kind of whiny and fussy in the morning, and I thought honestly she was bored. Like, okay,
oh yeah, if you spend days cooped up in the house
and I'm
not
like,
moving,
okay, let's get you dressed, let's get your hair did, get you going, and so I coordinated with my friend, and we got things set up, and we were gonna go and meet up together and stuff, and the 10 minutes that it took me to have her in her high chair and brush her hair and get it in a ponytail and stuff. And then getting her into her wheelchair in the van and driving out to this place, which was only like 15 minutes.
Mm-hmm.
We got there. She fussed the whole time. And I'm like, I just kept thinking maybe she was just antsy, and then you could tell she did not want to be outside, which it was really hot yesterday, and she kept rubbing her head, rubbing her face. We were there for 15 minutes, if that, and she just was not having it. So I'm like, you know what? I think she's still got headaches. I think her back is still sore.
Mm-hmm.
But and nothing, it was out in a big open lot, but the lot was grass and uneven.
Mm-hmm.
So kind of pushing her on that and bouncing around, I'm sure didn't feel great on her back still. So we came home, and I was bummed about that because I was just like, gosh, man, pretty much a week into it, and she's still recovering. She still can't go out and just have a fun day with me. And it kind of frustrated me because we put her through all of that and we got nothing.
Right. Except for a miserable child.
Yeah. A
Honestly.
child that was just hating life for a week, headaches and vomiting.
And we're just getting over it. We're still not. She's still sore.
I think today's been the best day because like this morning she was up, she was active, no whining, no fussing or anything. I would give her breaks. Like she'd be in her beanbag chair, or she was in her little chair this morning, and so after her feed I took her out of that and laid her down on the floor, and I laid down with her, and we just kind of hung out and played, and she was very talkative and playing and kicking, and so then I put her in her beanbag chair and tried to watch TV. Our internet's being stupid, but she's been good today. She was in her high chair for a little while and stuff, but you can definitely tell after about 45 minutes she needs to like take a little break, stretch out, lay down. And here it is Sunday.
Yep.
Of, you know, the week that she got it done.
Yeah.
So literally 6 days and she's still dealing with this shit. And it's like, for what? For what?
Yeah, that's how we feel.
And like Alisha said, the doctors were very nice. And we were very nice to them.
This is not like
we're not
blaming
trying,
them.
Yeah.
This is not one of those situations.
We're not trying to bash on anybody. We're not trying to bash on the hospital or
We are
nothing.
just disappointed with this situation and this outcome.
Funny thing is, though, the nurse said that our favorite doctor of Piper's informed her of us having a podcast, and she's like, "Oh my gosh!" She's like, "That is amazing!
Oh my gosh.
That is so cool that you guys do this." She's like, "Because there's a lot of times I just want to talk to these other parents and tell them, hey, do you want to go talk to this other family over here because they could help you?"
Yeah.
She's like, "But I can't do that by law.
Yeah.
I cannot do that, but I can tell them, you guys should check out this podcast."
Very
She's
true.
like, I can legally say that.
Yes, because we are around for everybody's ears to consume.
Yep. And so we're like, yeah.
I have to say,
pass along. Like if
the joy I felt when she was like, "Oh yeah, he totally informed me you have a podcast." I'm like,
she's like, I'm gonna have to check this out and
First of
tell
all,
other people. I'm like, I can't believe that.
he's amazing, which we've talked about on Dr. Awesome or
he is so good.
007.
007.
However you remember him. The fact that he like remembered, like he genuinely like asked me about it when he found out we had one, because he's great, he's amazing.
But for him to retain that
But to retain that
on a
information
personal
and
level,
then mention it to somebody, I was like, can you get any better of
like,
a person?
this guy's amazing.
Like,
He really
I just
is.
don't even know. Can you get better?
He's
as
not
a
one of those
human?
doctors that has. He hasn't lost his passion for the the medicine, and
I hope
and
he never does, because he's just.
It hasn't worn him down to the
human.
point where it's like, well, I've put so much time of my life into doing this, and I make good money, so I'll just keep doing it. But he's like cold to it. No, this man is amazing.
Ugh.
And he does. For him to just even mention in passing, oh yeah, this patient, blah blah blah.
So cool.
You know, they do a podcast and they reach out and stuff, and she's like, I just think it's the greatest thing. It's the best. Like,
so
I
cool.
will pass this along.
Yes. Best
so
human.
if you are a new listener and you happen to have heard it from some awesome nurse and you're just now listening to the podcast, or
welcome,
you've listened and caught up and got to this point, and you know that you are this listener or a part of these listeners, thank you.
Oh my gosh.
Because it was a very awesome moment for the nurse to just pop off like, oh yeah, he mentioned the podcast.
I know.
And it was like,
oh just so cool that he just remembered. I know. He's always been great about that though. So I guess I shouldn't be so surprised. He's very great about that.
He's very, very great doctor. And if he is
a great human,
he's a great human.
Yes.
If he's as awesome with his other patients as he is with Piper, like I
can't imagine he's not.
Yeah, right. Like
it's just who he is.
He's awesome.
Anyways, whew.
Really,
now we've
really.
I know, really. So again, we said this was a trial to see which procedure would best suit Piper in the long run. There's two different procedures.
I was going to say, yeah, let's mention the two procedures.
There's two different procedures. So one of them is putting a pump inside of her body that's filled with baclofen, so the stuff they put into her spine. And there's a tube that goes from this pump into her spine. Fun stuff. And it will pump a given amount of baclofen, every day or I don't know the specifics, but yes, it pumps baclofen.
It gets programmed.
Yes.
Essentially, for a dosage, and it gives her this dosage.
So the upside of this mechanism is it's very controllable on how loose you can make somebody's muscles.
You can increase the dosage. You can decrease the dosage.
Yeah. So it's fine-tuning, figuring out what works for Piper personally.
Yep.
Which is amazing, especially because for Piper, she uses some of that muscle tone to stand, to help when she pushes to stand. She's
adapted her body because of this increased muscle tone, and being a child and being born with it. She's able to adapt to it. She's using it to her benefit. She's
She is.
finding the fucking silver lining. And, you know, like with her therapy, she is able to now push and use those muscles just a little bit to kind of stand and move those legs and do some things and stuff that we're very excited about now.
Yes. So that's the upside of this pump, because they can just loosen her enough that she's not fighting her own body so much, and can still provide that support for her to do the things that she's learned to do.
But downsides.
Yes. I mean, of course, everything's got an up and a down. And
everything's got its pros and cons. It's right off the bat. It's a piece of equipment.
Mm-hmm.
Right there says it all.
We haven't had very good luck with things that have been implanted in her body.
No.
So the idea of another thing planted inside of her
Because
body.
we were told her shunt was supposed to last a minimum of 2 years. Not even 2 months later, it failed.
It did.
The first one.
The first 2 years, we had 4 or 5 revisions.
Yeah,
they
it was
just failed
ridiculous.
constantly.
So these, just being a piece of machinery, a piece of equipment, we have to worry about it not working at all. She just has something sitting in there and it doesn't do what it's supposed to do, or it overdoses her.
They've never, so as far as I'm aware of, just let me clarify, a machine has never malfunctioned and overdosed a child.
No.
But human error happens. They are very, very cautious. They have lots of things. But unfortunately, we have these these strict rules in place because obviously there
is human error.
Yes. They are few, far between, very rare. But yes, can happen.
So then also, she would have to go in every, 4 months to have it essentially
refilled.
It's a refill. She'd get an injection in her stomach or poked in her stomach. There's a little silicone hole in this piece of equipment, and it would be placed just under her fat tissue in her stomach.
Mm-hmm. I will actually post the picture. I have a picture of what the pump looks like sitting on her stomach where they actually implant it. So you can have a better idea if that's something you want to see.
So then every 4 months, she'd have to go in. They would poke her in her stomach. What they do is they pull the last little bit from the reservoir tank.
So the old medication.
Because it loses its potency.
Mm-hmm.
And then they top it off with a new batch, which she would have to go and deal with that.
Yeah, and so it's every 3 to 6 months depending on your dosage.
There it is.
Yes.
3 to 6 months.
Because obviously everybody's got a different dosage, but
yeah.
So every 3 to 6 months you have to go in and it's like a shot. If you would assume you're being poked with a needle,
I would just imagine it to be similar to a diabetic person maybe giving themselves insulin.
I have no idea.
It's just like another shot. And then
every 7 years, the pumps need to be replaced.
She'd have to have another surgery, get cut open, have it removed and replaced.
So it would be another incision on her poor stomach that's
which is already riddled with scar tissue.
Yes.
No, I'm like...
Yes. So there are lots of factors for us that play into that. There are lots of people who have these pumps and they absolutely love them.
Yes.
Nothing
to go against this procedure.
No.
It just doesn't seem like it's going to work for us.
Again, this is our personal feelings, our personal thoughts. There are lots of people whose kids have these and they love them, which is great.
Because you're able to fine tune them. And, like Alisha said, it doesn't happen very often, but it does happen.
Just like anything.
Can have some malfunctions and stuff. But, there are many people that have these and it works for them. It helps them.
Definitely. So
we're just kind of...
we're just super hesitant because Piper does not, for as many surgeries as she has had, she doesn't not necessarily do well. She's a trooper and
she's a soldier, but it always seems like there's something.
If we go back and we actually, I can't tell you how many times she's ended up in the ICU because after a procedure, all of a sudden it's just like
something happens. She tanks for some reason.
I don't know if she's just tired.
I think that's what it is.
She's her mama.
I think that's what it might be. Is
I'm tired,
she gets
people.
these procedures and she has to get intubated because, like, they put her under, so they intubate her. And then it's just like, oh, I don't have to fight with my body to breathe?
Well, it's not even that. 'Cause
Like-
she comes off of it.
Well, yeah, she does.
She comes off of it, and then we're talking 12 and 24 hours later, all of a sudden, she
I don't
tanks.
know if I want to do this.
Yeah.
It was easier.
Which is terrifying. It's not a good feeling when, they call a code and everybody runs in, and then they tell you they have to take you to the ICU and intubate her, and they don't have any answers. It sucks.
It's true. It does suck. And it happens more often than we'd like to admit.
So that's terrifying. The fact is, we just have to take these things into consideration, and I don't love any of it. Let's just be honest. I don't like any of the options. I'm not happy about any of them. So we're just doing the best we can with the knowledge that we have.
So that would be procedure number 1 and
Yes.
the trial that we dealt with, which is the baclofen pump. The second procedure that we have talked about, it is in our option menu in what SCR?
SDR.
SDR procedure. I can't remember what it stands for. Don't ask me.
Selective dorsal rhizotomy.
I'm like rhizotomy.
Rhizotomy.
Whatever.
Yeah.
That's the one I can read.
Rhizotomy. Something like that. Selective dorsal rhizotomy. There you go. That's what it's called. So for someone like Piper, before we had this lovely input from this last week, was the winning thought we had for us that we were leaning towards, because a lot of Piper's high muscle tone is in her legs. It does affect her left arm, but she still functions rather well with her left arm. It's not really.
She's still very tight, but
Yes.
she's definitely able to do a little more with her arm than she is with her leg.
Yes, but her legs are incredibly tight, which is actually why she gets Botox in her legs to help with that. So the pump would affect the whole body, and this other procedure only affects your legs, which
Lower extremity, yeah.
is, great for somebody where you want to focus.
There's a reason I'm laughing.
Oh my
And if
goodness.
anybody heard it on this show, that was
I don't
great.
think they heard that one.
No.
It wasn't quite as
It
loud
was
as
just
the last one.
deep and little.
Anyways, the biggest downside to this procedure is that it's permanent. You can't undo it. You can't say, "Whoops, that didn't work."
Can't adjust it.
You are
can't tweak it.
basically just
You snip that nerve. It's one and done.
So that's what they do. They go into your back and they snip selective nerves that help interrupt your brain from saying
it interrupts
contract your
the
muscles.
signal. Yeah,
Yes.
it interrupts the signal from
So
your
you
brain
can
to your
still
muscle.
your brain is still in control of your legs. That hasn't gone anywhere. Like, it sounds terrifying because you're like, so you're just taking that away from her.
Yeah, but that's the thing though, is like different nerves control different things, and these ones control that extra flex.
Yes. So that's just the downside is
Yeah.
once you do it, you can't undo it. So if you don't like the results, well, too bad. This is the decision you made, and now you got to live with it.
The worst part about it for me is that Piper can't tell us her choice.
Yes. And we talked about this on the way home. Like, it would be so nice if she could voice her opinion to us in a way that we could understand.
Yeah. If she could be like, you know what, I know you guys are scared about this pump, but I want to give it a shot.
Yeah. But
Done.
I would rather do that.
Done. Then, if she was to be like, I don't want them to mess with my back.
Mhm.
Like, I don't know.
Which is also terrifying. I don't like anything with...
I don't like any of our options. This
No.
This shit sucks.
And that's what I was saying. I'm like, these options aren't winning. And I don't feel good about any of them.
No, not even a little bit.
And
But
unfortunately...
the fact that Piper can't even voice her opinion on what happens with her own body breaks my heart.
Yeah, it sucks.
Because she's there.
Yep.
100%. And you can ask any other typical 8-year-old, you can give them options.
Or have a
Or
conversation
have a
with
conversation. Yeah, have a conversation with them and just tell them, these are options.
And chances are, if they're 8 and they've lived any life like Piper and had multiple procedures and done all these things,
They're going to have an opinion.
They probably will have an opinion. I could be wrong, but I'm
you
just
go ask
saying.
any cancer kid that's up there that's been
Probably have
poked
an
and
opinion.
prodded over the years, and if they were given options, you know, I'm sure that they've had input on what's going on.
So yes, that's hard. And we just have to make the best choices we can with the information we have and hope that it works out. Which does not sound awesome.
No, it does not. No, it does not.
So that's, I mean, it's kind of where we're sitting right now.
Well, and, you know, like just...
Well, and we were talking about today, like, we have other procedures that need to get done.
Yes.
And we need to figure out, like, it's just ongoing.
We really don't have, Piper really doesn't have a bunch of time for us to just kind of sit around and float up on
in all fairness,
ideas.
Yes, we could sit around and wait. These decisions aren't like technically like life and death.
Yeah, no, they're not life or death situations.
The longer we wait, the more complicated and difficult things become.
Yes. So,
yes, we just have to make choices as fast as we can, apparently. Ugh. So I'm not looking forward to that. So yeah, I think that's, I mean, is there something else you want to cover? Is there something else you want to say?
No, I mean, it's
a lot of technical information.
It is.
If you don't know Piper and don't have a kid that's going through this, you probably don't care. But here we are. This is our lives. This is our child. This is what's happening. And so we're letting you all know.
It's just a lot of stress.
Stress? I don't know what you're talking about.
It's just a lot of stress and emotionally.
Stress spelled backwards is desserts.
No. It doesn't help desserts. They don't help the situation.
They don't, but you know what? I have realized that I'm definitely a stress eater. It is not doing any wonders for my waistline. Let me just tell you right now. But it's summer and I wear lots of dresses, so we're good to go. Winter might be hard. My pants might not fit.
So yeah, I think that's pretty much all we wanted to cover was just her procedure and this week and what we kind of dealt with and where we're at. And
yeah.
I think we covered that.
All that fun technical stuff.
Yeah.
But if you hang around, you know, eventually she'll get something done that we just talked about and you might have a heads up and you'll be like, I remember that. Or not. I don't know. We'll see. Thanks for listening.
Yeah. Well, we'll catch you next week.
Bye.
Bye.